Okay, so I'm going to have you doing two moves. The first one is going to be kind of like your cat camels, but a little more specific to the area. And then the second one is going to add a little bit of rotation element, because I'm thinking that if we can get you comfortable in rotation, then it's going to help unlock all those things. There's a lot of deep musculature, and the pain pattern that you marked up kind of showed me that there's like you have these small little muscles like your multifidus and all your other stuff that it really lights up and it causes pain even though there's no real structural damage. So first things first is gonna be a quadruped, right? And you're gonna go all the way back and arch as much as you can, like we talked about. Draw the belly in, and then now you're gonna use your upper body in kind of your lower body. Go into a Cobra press position, except you're only using your arms to push you up. You're not using your back or your lower body. It's just the upper body that's doing it. And you're gonna big brace. Pushing your abs out and down, and then you're gonna go back. And the other thing, you're gonna round everything out, pull the belly in, go back all the way, big brace. And you're gonna go back and forth with the bracing and the pulling in between 10 and 20 times. The more you can do, the better. If anything lights up or is in pain, go just before the pain. Keep doing that for a couple reps, and then just a little bit further, closer to the pain, couple more reps. Again, we're trying to like facilitate your body understanding that you can get into these positions. So that was number one, right? Number two is gonna be rotation, right, rotation. So essentially you're just gonna lay down. I don't have enough room. So you're gonna lay down, and you're essentially gonna focus on rotation through your lumbar, which like, the lumbar doesn't actually rotate all that much, but that's neither here nor there. So what I'm gonna have you do is bring your knees up, right? Use your arms to post out, kind of like hold yourself, and you're gonna actively rotate through your T-spine, through your lumbar, and you're gonna go all the way over, controlled the whole time. You're not just throwing yourself away. Excuse the pants. And you don't have to brace for this the entire time. You can brace if you would like to. That might actually facilitate some other stuff, but sometimes that kind of locks things up. So for the first few reps, don't brace at all. But for the latter reps, try to brace. And as you get better at this, I want you to figure out your deep breathing into your balls situation. So it's gonna be, at the end of it, it's gonna look kind of like, and so when you're in the knees up and to the side, I want you holding your weight up. I don't want you to just plop on the ground. It's gonna be kind of like a light touch, so you're still contracted, and I want you to feel your abby poos pushing out and your obliques start to contract and also press out as if you're blowing up a balloon. So again, 10 to 20 reps of that. Before doing any of this, something you can do is take the lacrosse ball, if you have a hard one, that's even better, and run up and down your erectors. The ones that I want you to focus on are twofold. It's going to be one, so you have two ridges, right? Two ridges of erectors. I want you to go on the, there we go, on the inside of the erector, right? But not on the spine, just the muscle. And what I want you to do is when you lay on it, put the ball under you. You're gonna big brace, hold it, and then relax into it. Let all your air out. And you're gonna have big breaths, chilling on it, maybe 5 breaths, move it down an inch. 5 breaths, move it down an inch. And then the other one I'm gonna have you do is roll out your lats. A lot of the time, people's lats insert into this like fascial area in the lumbar, like a lot, the erectors go into that too. It's a non-contractile tissue, but it can get really pissed off, and when that gets pissed off, it's going to piss off the muscles around it. When you're all locked up, all those smaller muscles that we mentioned, like the multifidus, your rotators, and your other things that aren't really important for you to know, they can get super, super angry just because the fascia is fucked up, or like a lot of times what happens is your lats are fucked up and really tight, and so it doesn't let the lumbar fascia move the way it needs to move. Even though it's not in contractile tissue, it does still move. It just doesn't contract. So when the lats or another muscle makes that fascial thing not move, the other muscles that also attach into the fascia kind of have to make up, how would you say it? They have to make up for it, and sometimes those compensations cause pain. And I think that's what you're having, because you don't have any radiating pain. It makes me think that there's no spinal damage. There's no disc issues. Nothing pressing on a nerve. If anything, it's a peripheral nerve issue. But worst comes to worst, I'll have you see a chiropractor, and I'll email him, tell him what's up, give him a little more direction, and then we'll go from there. But try these two things. Once again, it was the cat camel situation, except where you're going back and forth, and the other one is the rotation element.